What is the subunit of your normal in your blood? Hemoglobin. What is the type of your hemoglobin? Hemoglobin A, hemoglobin A2, hemoglobin S, hemoglobin F, A2. No. A2 is present only the less than 2% patient. Less than 2% আমাদের কাছে. Most of the 95% present as a একটু সাউন্ড আসতে করো. এই রিমা সাউন্ড আসতে করো. বলো. হ্যাঁ? A1 or A. You can say that A, only the A. Don't take it as a confusion. Sound bar ektu. Okay. So what are the subunits of HbA? Alpha 2 and beta 2. Good. If this beta subunit is mutated, then one diseases can happen. What is the name of the disease? Normally. No. What do you mean by thalassemia? Thalassemia is alpha thalassemia and the beta thalassemia. If there is a quantitative problem of this HbA, quantitative problem, then what is the disease? Already told. Quantitative means sickle cell anemia, right? What will be the presentations? How can you expect or suspect the patient may be suffering from sickle cell anemia? Anyone? কি করে বুঝবি? All is present with pallor, tiredness, hemoglobinopathy. Any hemoglobinopathy may come as the same symptoms. Hemoglobinopathy may come as a pallor, fatigue, respiratory problem, that may be jaundice, bone pain, etc. That may happen. But how can you first, in the first two days clinical scenario in your OPD or at your clinics, how can you suspect that may present as a sickle cell anemia? And what is the age of these thalassemia or sickle cell anemia presentations? 2 মাসে আসবে, 2 months baby আসবে, আসবে না, কেউ না বলছে। 2 months কি sickle cell anemia thalassemia আমার presentations হবে? If not, why? বল। তোকেই বলছি। আমি তো টেরা নই রে বাবা, টেরা ভাবছিস নাকি আমাকে? I have no squint at all. I am a very much healthiest person. Tell me, why? And if it is yes, if it is present in the 2 months of age in an infant, you are suspecting the thalassemia. Can you suspect? Why? That is the presence of the HbF. What is the composition of HbF? What is the subunits? Alpha 2, delta 2 কার আছে? Alpha 2, gamma 2, right. Alpha 2, delta 2 কার আছে? A2, right. This is important. If you are given any answer, sound technique. So, sickle cell anemia, what is the problem? What is the problem? কোথায় প্রবলেম হয়? পড়েছিস তোরা? কি হয়? বল। What is the problem? 6 position of beta chain. How many amino acids are in the beta chain? 146. And alpha chain? 141. So some amino acid sequence are there, right? Suppose this is your sequence, and also there's the beta chain. Beta chain chromosome number? Beta chain chromosome number 11 and alpha chain 16. So this, if you teach that like that 6, 7, 8 and etc. 8, it's 8. So 6 part of these 6 positions of the beta chain কি হবে এখানে? Non-conservative missense mutations. Total termটা very important. Non-conservative missense mutation. Mutation of what? 6 positions. কি থাকে? Normally glutamine or glutamate. That is hydrophilic. And if it is mutated, mutation means what? Which gene? HBB gene. For the beta, B for last beta, hemoglobin beta gene is a mutations. Mutation of what? Non-conservative missense point mutation. You can say missense point mutation. This is a type of point mutation. This is your chemistry part. I am not going details about the mutation. So why it is called non-conservative? Non-conservative means what? There are 6 positions. There was a glutamine or glutamate, that is a acidic part, and then you transform into valine, right? That is a valine, and valine is a hydrophobic in nature, so that it is called non-conservative. Non-conservative means what? The codon is changing. Which codon is depicted by the glutamate? One nucleotide change jonno, that is happening to the valine, and this valine is your hydrophobic. What is mean by hydrophobic? মানে জলকে ভয় পায়, right? So problemটা কি হচ্ছে? Problem হচ্ছে, for this reason this is are not present as a HbA, this is present as a HbS, right? This is a sickle cell hemoglobin. Problem is that if anyone may be carrier, আমাদের মধ্যেও কেউ না কেউ হয়তো carrier আছে. Carrier does not seem in feature if not under stress, under deoxygenate place or any infection. You can say it is stress. Stress means any infections, you are taking a lack of, feeling the lack of oxygen, etc. That trait may come as a mild symptoms with valor, with respiratory problem. But otherwise, if it is HbS, is a mutations, is 100% mutations, then may feature come after the 6 months of age, because in the meantime এইটার যেমন আমার থাকবে কিন্তু alpha 2 and beta 2 but damaged. You can write that, এইটা যদি মনে রাখতে পারিস, that is good one, that is a 6 glutamate into valine, ঠিক আছে? This is your, it is HbS. That means in the 6 positions of your beta chain, due to the non-conservative point mutation, the glutamate is changes into the valine, right? So I'm not going details into the sickle cell anemia, because sickle cell anemia is a huge chapter. I can take as a 1 month long. এক মাস ধরে আমি sickle cell anemia পড়াতে পারি. This is a very important characteristic. Last 6 months back, I have diagnosed one sickle cell anemia. Already told you, sickle cell diagnosis is not so much easy. Patients came to me, only presentation was only the joint pain. How can you expect in the first day of OPD that a joint pain may come into a landed into a sickle cell anemia diagnosis? It's very tough. Okay. Anyway, the patients believe me on me. After the 3 months of follow-up, I came to the diagnosis the patient is suffering from a sickle cell anemia, and sickle cell anemia major basically is coming, because already 2 transfusion already given in the BPSC. There's a block health center, but nobody has think that there is a patient is having some problems. Now he came to me as a bone pain only, right? So bone pain is a feature, is an important feature. Bone pain means what? সে বলছে আমার এইগুলো আঙুলগুলো প্রচন্ড ব্যথা পায়ে এবং এতে, that is called dactylitis. That is called dactylitis. Dactylitis is a most important, dactylitis. Any itis means inflammations, right? Any itis means inflammations. Hepatitis, huh? You can say there is a gastritis. Any itis mean inflammation. If you know details about the inflammation, actually if I take the immunity chapter, I already some sorts of classes I take for the inflammation, and inflammation is our bread and butter. আমি এখন ওইটা করেই খাই. I know much more better the inflammations than other subjects. So inflammations means your disease. So if you understand properly in inflammations, then it is a great thing. So anything you are this itis, the inflammation is going on. First day I never think about the sickle cell anemia. I thought some different way. I suspect that patients having often a fever, weight loss is there. So maybe they come into the ALL. It is acute blood cancer or acute leukemia, acute lymphoblastic lymphoma. But ultimately, when I follow up the patients and taking repeated history again and again, I go for a HPLC of all his family members. Then I saw that his mother and also his father is carrying the HbS carrier. So HbS carrier means the baby has 25% chance to be a sickle cell. It's unfortunate, but sickle cell anemia is not so dangerous nowadays. The patient will die within the months. No, not at all. Problem is that oxygen, right? I'm coming. If it is oxygen is good enough, the sickling of the RBC is not possible. Problem is the sickling of the RBC. That means shape of the RBC will be changed. And if the sickling of the RBC means RBC এরকম থাকে, if the RBC is going like sickle, then the problem is that microvasculature, right? Circulation is a problem, so block the area, and that causes the vaso-occlusive disease or vaso-occlusive crisis. Vaso-occlusion মানে বন্ধ, vaso মানে vessels, mostly the venous area. That's why the patient is coming with the dactylitis. Itis means inflammation. So HbF is formed. Problem is that the concentration of more than 60% of HbS, presence of HbA percentage, if it is more than 60% in your peripheral body HbS, then problem is that polymerization of this HbS happens. Now the question is, what do you mean by polymerizations and what is the effect of that, right? So you know that now this is your pattern: alpha 2 beta 2 6 position glutamate to valine. Valine is a hydrophobic, not the hydrophilic. So hydrophilic থেকে hydrophobic হয়ে গেছে, and that is a problem issue of HbS formations due to the non-conservative missense point mutations at the level of beta globin chains. Now HbS transform into HbS. So now the problem is that many HbS will like that, HbS, okay, and so these polymerization chains like that it look out, and this is a molecular pattern of this HbS, clumping of these polymerizations, একটার সঙ্গে একটা connections করছে. Now how can we expect that these polymers can pass through the microcirculations? You think about that. If it is goes to the cardiological মানে heart circulations, that is a different coronary arteries are very very small, that may cause infarctions. In the brain, that may see stroke. So presentation and symptom will be like that. In case of bones, that is avascular necrosis. What do you mean by avascular necrosis? Means blood vessel যাচ্ছে না, necrosed হয়ে যাবে যদি blood vessel না যায়. Necrose মানে পচে যাও, simple cell death. Okay, so this can happen, and that may present in the little bit adolescence period, come to 16 years of age. That may present as a fracture of femoral. I have seen one cases in case of orthopedics that was done. I go through that to check the patients in whenever I was in the ESI Joka. So in that patients came with only the fracture of femur, right? Ultimately diagnosis is avascular necrosis. During the follow-up in investigation, HPLC, then I detect that is a HbS is present. So HbS is a presentations may come with a different way. Means the pain, means the infarctions, means the ischemic attack, heart attack, stroke, acute chest syndrome, acute chest pain. Only the chest pain may come. I have never across with the chest pain because this is a feature. Feature is that only the polymerizations of this. If it is polymer formation is going on, only polymerizations will be formed if it is 60%, more than 60% of the HbS is formed. If it is 30%, nobody problem at all. He will go into asymptomatic. Problem is sickle cell anemia with the polymerizations. So these polymer and polymerizations causes what? Suppose this is your RBC cell. I am not come details into the cell because RBC will be taken in this separate class. So these are the RBC cell membrane. Membrane means you already know, probably lipid bilayer is there, right? Anyway, this problem is that whenever this polymerizations happens, then the one calcium ion from the hair out of the cell to come into the cell. To maintain the electronegativity, potassium will be out. If potassium will be out, then along with this water will be out from the cell. So if now in a RBC cell, suppose this is the RBC cell and this is the HbS, this is hemoglobin, that is called HbS. Now problem is that this water is coming out of the cell. That means shrinkage of the cell is happening. That means cell is dehydrated, right? So cells, if it is dehydrated, then what is happening here? Concentration. একটা জলের মধ্যে চিনি আছে, তুই যত চিনি ঢালবি সেটা কনসেন্ট্রেশন হবে, ঠিক আছে? জল থেকে জলটা বের করে দিচ্ছিস, তাহলে কি হবে? চিনি কনসেন্ট্রেশন বেড়ে যাবে, রাইট? যদি আমার জল এখান থেকে বেরিয়ে যায়, সো কনসেন্ট্রেশন অফ দিস ওয়ান উইল বি ইনক্রিজড, and that can cause the polymerizations. And polymerization যতবার হবে, the cell will be damaged, the cell membrane will be damaged, and so the sickle cell shape will take. And if sickle cell is going to this, it is a lifelong. আমাদের যেমন RBC 120 তার হয়ে যাবে হয়তো 40 days. So lifespan will be reduced. So hemolysis will happening in the spleen, maybe in the vascular level or intravascular. Both hemolysis can happen, and that may present with the other symptoms like jaundice, like your chest pain, your stroke for the blockage. This is a sickle cell type. Problem is that oxygen. This happens mostly in the deoxygenated state. Deoxygenated state is happening. Remember one circle for your whole life. for your whole life. One circle is that no oxygen, no oxygen. It causing the sickling, right? If it's sickling, then it is hemolysis, right? এইটুকু তো বোঝা গেছে এখন. If it is hemolysis, then RBC will be reduced. Do you think that if RBC is reduced and within the RBC there is a hemoglobin, hem means heme and globin, within the heme there is a protoporphyrin reading an iron +2. If +2 is present means oxygen carrier. Oxygen carry coach, if it is hemolysis, so there will be again no O2. Oxygen will be less. So if one episodes, if happens is due to the deoxygenated state or hypoxia, that may cause the sickling going on and on, off and on. এখানে অক্সিজেন নেই, সিকলিং, হেমোলাইসিস হয়ে গেছে, আরবিসি কাউন্ট কমে গেছে, ক্যারি করতে পারবে না, আবার অক্সিজেন কম, আবার সিকলিং. So this is happening. It is happens into the after the 6 months of age this happen, and it will take some time, may 3 to 4 hours, 4 years may take. Not hours, it is years. 3 to 4 years may take for this number of sickle cell may be increased, and that can cause the blockage of the vessels, and that is called vaso-occlusive crisis, or you can say as a pain crisis. You can say the pain crisis. এই পেশেন্টটা আমার কাছে পেন ক্রাইসিস নিয়ে এসেছিল. I misdiagnosed in the first 1 month. Then I suspect that something is happening. Why not we do for the family HPLC? After that, within the 2 months, detection is the carrier, and then the HBS is present in the baby. So diagnosis is very clear to me, and the treatment was given. What is the treatment? Mostly treatment is nowadays is a bone marrow transplantation as well as gene therapy is going on, because already you know that is a non-conservative missense mutation is happening the genetic level. So gene therapy is also a treatment protocol. In the meantime, some drugs we are given, that is a hydroxyurea. What is the maintain or utility of the hydroxyurea? It's just for your knowledge only. It will not come never in your exam. It is hydroxyurea. It increases the gamma 2. If it is gamma 2, then there is no beta 2, and beta 2 is a damaged. So beta 2 is a mutated. So if we increase the alpha to gamma 2, then patient will say much more affinity for the oxygen, and that will carry and he or she may come without any symptoms or less symptoms at all. So to some extent, but curative is nowadays thalassemia as well as it is a bone marrow transplantations is nowadays very much going on in the Kolkata also, and it is lot of patients in now very cured. So nowadays is not that their thalassemia কখনো ভালো হয় না, শুধু blood নিয়ে যাবে, not at all. Problem is that these patients may suffer with different types of secondary hemochromatosis. I am not going at all. What do you mean by hemochromatosis? It is the iron overload. You are not utilizing the iron as well as you are giving the blood transfusion. So iron level in your body, especially in the storage in the liver, will increase, and that may landed into the secondary hemochromatosis. Right? So all three this in the hemoglobin S is due to the deoxygenation state. It is sickling is present. Before the sickling, polymerizations happen in the cell membrane. What has come out? So there is a dehydrated cell. It is called dehydrated cell. Dehydration means jol variable. So dehydration means shrinkage. If it is dehydrated, that's why the concentration of the HBS inside your RBC, it will be increase of concentration of HBS. If it is more than 60%, then polymerization happens. If polymerization happens, then the sickling happens. If sickling happens, then the vaso-occlusive, all the microcirculation will be blocked by this sickling process, because normally is a biconvex, right? Flexibility is there. So it can go through the most vascular areas, but not there. The sickling is present means is clumping is happening and blocked in microcirculation, and wherever in your body is microcirculation, that may come as a ischemic attacks or your infarctions. Two terms is important: ischemic and infarctions, due to the lack of blood supply to that organs, right? So it can chest pulmonary vessels, that may in the coronary vessels, the heart, in the bones, avascular necrosis may come as the dactylitis, is a very characteristic feature. So there is a pain crisis may be present only the sickle cell anemia. Not only that, the patient was very pallid. All the anemia patient may come with the different types of pallid, lethargy, respiratory problem, on and off fever is going on. But the sickle cell anemia pain crisis is a characteristic finding, and you have to suspect. If not in the first two visit, you have to definitely do something. Otherwise, the patient you will lose the patients. আমি যদি এটা ডায়াগনোস করতে না পারতাম আর একটা দুটো ভিজিটে পেশেন্ট পার্টি কিন্তু ভেঙে যেত। So if in the bhege jodi jeto and so some educated person is come to that galo oi patients. So remember that don't miss the diagnosis. If you try, keep faith. Faith রাখতে হবে patient কে এমন ভাবে ফার্স্টেই বলতে হবে যে you can treat and you can diagnose the patients. We have seen the patients like that. Say faith আনতে হবে তবেই they will come again and revisits. Some diseases you can't diagnose in the first day. It's not your upper respiratory infections or pneumonia. It's very easy one day diagnosis. It is without any X-ray. I can detect in the chest is a pneumonia that may be viral, that may be bacterial. If I know that the tuning of this stethoscope in the chest. But in case of this is a genetic disease, you can't detect in the first 2 to 3 visits. You can miss the diagnosis. And then if it is missed, then the patients may crisis and catastrophically his hemoglobin level was 7. That means if it's something, it patient's relative the thing that you will go to the Gangtok, etc. That means high altitude problem. So in the meantime, before the bone marrow transplantation, etc., I advised him not to take his child to the high altitude because of this deoxygenation. Because deoxygenation means no oxygen, sickling number will be increased, hemolysis will be increased, and then again no oxygen, again sickling, and this going on and on. Ultimately increase of level of sickling. And this sickling and RBC will block the microcirculations. That's enough for you at this stage, because if I continue, lots of things are there, lots of pathology are there. I can understand you are taking some points from this. Only points is that the beta globin chain 6 positions is very important for you. Is a valine, it is a hydrophobic nature. That's why the water is coming out for the calcium in, potassium out. With the potassium, water is coming out of the cell. So water is decreasing inside the cell. That means concentration of the HbS is increased, right? If concentration of Hb is increased and more than 60%, then sickling can happen. As well as in the deoxygenated state, sickling can happen. So both are these aggravate the features and that may come into the symptoms, right? Now one patient, suppose one patients have come, whatever it may be, the 20 years male patient, right? Male patients come with presentations with fever, with pallor, right? Respiratory distress, right? Jaundice. So whenever you are dealing with a pallor and jaundice, always suspect that maybe the hemolytic anemia or some sorts of blood pathology is there. That means some this respiratory distress, jaundice for last suppose in the 6 months, 6 months ধরে জ্বর আসছে. Hepatosplenomegaly, spleen and liver increase size. Hepato means liver, hepatosplenomegaly, that means both hepatic liver and spleen are enlarged by the palpations. Whenever you go for the GI in clinical classes, if I take, then I can teach you how to see the liver palpation. It's very easy. And so it is hand is come on, and this is increase this. Whenever you dealing with such patients, always suspect and go for only the CBC. Only go for the CBC. CBC is very important. Complete blood count. Within this blood count, the patients may come with some abnormal cell, that is a blast cell. That may come as a blast cell suspect of any blood cancer you are dealing with or not. That means bone marrow. So bone marrow aspiration is the next choice. The bone marrow aspirations, bone marrow biopsy will be done. So now we have to understand why we should know about the bone marrow. Because bone marrow is a site where the form elements of cells are coming on. Whenever we go for the CBC, it is see that is hemoglobin is less, is RBC is less, WBC is less, platelet is late. So this is RBC late, WBC late and platelet late. It is as a whole, it is called pancytopenia. Pan means all, pancytopenia. So such patients, you have to understand properly how RBC is formed, how WBC is formed, from where it is formed, and also platelet where form it is formed. Anybody you know these cells from where it is formed in your body? কোথা থেকে তৈরি হয় বলো? বোন ম্যারো থেকে তৈরি হয়. চলো, তো বোন ম্যারো হাউস, বোন ম্যারো ইজ আওয়ার হাউস. এবার কোন বোন ম্যারো থেকে হয়? আমার হাতে থেকে কেন হচ্ছে? বোন আর বোনস আর দেয়ার, সিট ডাউন. কোন বোন ম্যারোতে হয়? মনে কর তোর আর আমারই বলছি. মনে রাখবি, axial part of axial skeletal থেকে বোনস থেকে হয়, যেমন হচ্ছে তো রিবস, যেমন ক্ল্যাভিকেল, যেমন স্টার্নাম, যেমন স্ক্যাল, রাইট, পেলভিস, ভার্টিব্রা, right, sacrum. You will go for the anatomy for your bone culture. So axially this is present. This axial skeletal structures are the membranous bone, right? So membranous bone marrow, and within the bone marrow there are two sorts of, there is red bone marrow, another is the yellow bone marrow. Now a red bone marrow is the capacity for the formation of the form cell or blood cells. Yellow means কি থাকে, fats, adipose tissue, right? So that is not capable of the your formation of your blood cells. So red bone marrow is important, and this red bone marrow, whenever you are dealing with, that means you are dealing in every lots of diseases of this cancers, lymphoma, anything may come after the bone marrow aspiration, biopsy and testing and genetic study also. বোন ম্যারো থেকে আমরা এখন জেনেটিক স্টাডিও করে বলতে পারি যে কোন জিনটা এএলএল এর জন্য, সিএমএল, এএলএল, দিস টার্মস অনলি ইউ আর জাস্ট floatingly you just understand. There is ALL, that means acute lymphoblastic lymphoma, leukemia. Only you can say there is a blood cancer, right? Different types are there. I'm not going details. I try to understand that in your clinical practice, if such symptoms is coming on and you are dealing with a hepatosplenomegaly, jaundice and pallor, and often on fever for last 6 months, so already some sorts of problem is there, and you are seeing that the pancytopenia, that means all the cellular levels of POM cells in decreased level, then there is there's a and also the blast cell present in the peripheral smear. এই যে তোরা smear touches, smear এ দেখে দেখবে blast cell. What do you mean by blast? Any word in your mind, blast means what? That can potential for the differentiations, right? Say আরো division করতে পারে. So this is abnormal, this is a blast cell. Blast cell normally present in your blood? No. If not, we are suspecting anything, any blood cancer or any abnormal cells. So blast cells in your peripheral means always suspect. That's why if I get some patients in lower age, that is 6 years, 7 years, I have diagnosed lots of ALL patients. In children, mostly the ALL patients come, and nowadays ALL is very curative. But it is hectic, and also costly treatments happens, but curative. ALL, that means blood cancer in child, is nowadays curative. Super curative. So but after to diagnosis is very important. I have diagnosed lots of patients. Patient may come with a fever only, that patient has come as a joint pain only, may come as a abdominal pain. Whenever you are palpating abdominal pain, you are seeing the eto boro liver, eto boro spleen. That's why this pain is happening. Why so? That may be thalassemia also. In case of hemolytic anemia, that's also may come as a hepatosplenomegaly. Whatever it may be, CVC will help you, and CVC will guide you firstly, and then you have to go for your bone marrow aspiration and genetic testing for proper diagnosis. So bone marrow is now important class for you, right? Bone marrow means red bone marrow, and that is your, it is a pattern of this RBC synthesis first. That is called erythropoiesis. What do you mean by erythro? Red cells. Poiesis means synthesis. If we say the overall synthesis of blood cells, that is called hematopoiesis, right? Hemato means blood cells, and poiesis means synthesis. So hematopoiesis, within the hematopoiesis there is a part of the erythropoiesis, that is a leukopoiesis, thrombopoiesis. Thrombo means thrombocytes, platelet ke bola hoy thrombocytes. Leukocytes are called white blood cell. Leuko means white, right? Cyte means cells, but blast means differentiations are hobe. There is a lots of parts is there, that is a part of this. So we enter into the blast cell, right, into the blood, into the bone marrow. Within the bone marrow there is a stem cell, right? You already know that is the stem cell. I বললাম কি you already know, no at all, যে bone marrow the stem cell থাকে, কে জানতিস? Hematopoietic stem cells. So hematopoietic stem cells is called the pluripotent hematopoietic stem cells. Pluripotent hematopoietic stem cells, right? These are the present in the bone marrow. What is happening here? It is a bone marrow, right? So pluripotent means they can divide into cellular many multiple cell lines. তারা অনেক কিছু বানাতে পারে, সত্যিই তাই, অনেক কিছু বানাতে পারে। আরবিসি বানাতে পারে, ডব্লিউবিসি বানাতে পারে, আমার প্লেটলেট বানাতে পারে। So that's why it is called pluripotent. The first of all, it is pluripotent stem cell having some divisional lineage, right? One is lymphoid lineage, lymphoid series we will not discuss today. This is a lineage, and also myeloid. And this myeloids having 3 lineages there, right? Before that, it goes to formation of RBC, it forms to WBC, and as well as it is from the platelet, right? So this is the lymphocytes are coming, and this is the WBC, and then it is a platelet. Within the WBC, except the lymphocytes are formed in the lymphoid series. So first of all, pluripotent hematopoietic stem cell, then 2 lineages are there, myeloid lineage and lymphoid lineage. So within this myeloid lineage, we will concentrate about the formation of is RBC, because we are dealing with hemoglobin, we are dealing with RBC membrane, so have to detect the how and where it is detect in the form, how it is formation is there, and that is called erythropoiesis, right? That is called erythropoiesis. Erythro means red blood cells, poiesis means synthesis. So remember that it's oftenly asked your questions in theory also. They write the steps of erythropoiesis, right? That said, in that case, it may come as a write the synthesis of RBC cells. Same thing. So whatever it may be, myeloid series whenever is coming, first of all, it has to be committed. It has to be committed. Committed to what? Committed to formation of the RBC only, right? For that reason, first of all, blast forming unit E, erythroid, right? First of all, blast forming unit E is formed. Then it is transformed into colony forming unit E, right? These things are called progenitor cells or committed stem cell. In your book, you can came across with your suppose probably is the progenitor cells. What are progenitor cells? Progenitor cells blast forming unit E and colony forming unit E. That means E means key. E means erythroid. So now this CFAU is go to form into the mainly the precursor cell, first precursor cell, that is called pro-erythroblast. Yes, pro-erythroblast, right? So pro-erythroblast is the precursor cell for the formation of your RBC. কোত্থেকে এলো? Hematopoietic stem cell. কিভাবে এলো? 2 lineages are there, lymphoid as well as myeloid. We are concerned now is the myeloid. In the myeloid, there are 3 parts are going on for the formation of this. For the erythroid series, it first formed into the progenitor cell or committed stem cell. You can say these are the committed progenitor stem cell is a better term. Blast forming unit erythroid, colony forming unit erythroid, and then transform into precursor cell, first precursor pro-erythroblast. So whatever you are getting as a RBC or erythrocyte, if first stage is formed as a key, is a pro-erythroblast. Now question is that RBC এর মধ্যে থাকে কি লাগবে কি? RBC এর মধ্যে থাকে hemoglobin, hemoglobin এর মধ্যে থাকে heme and globin. Globin is a amino acid chains, that means protein আমাদের লাগবে যেটা খাচ্ছি, number 1. Number 2, there is some parts of iron also there, heme within the iron is must be there. For the DNA maturations, vitamin B12 and folic acid also essentials, right? And also our carbohydrate is a energy giving, and as well as fats, lots of fats are there into the cells requirement. So protein, carbohydrate, fat, vitamin B12, folic acid, iron are the important factors. It may be asked in theory, it may be asked in viva also. These things are important. যে কি কি লাগবে আমার, কি কি factors for the synthesis of this, and one of the important hormone is there, that is called erythropoietin or EPO. That is called EPO. কোত্থেকে বেরো EPO? EPO কোত্থেকে এলো? EPO means erythropoietin. Erythropoietin comes from the kidney. Kidney কোথায়? প্রত্যেকটা পয়েন্ট ইম্পর্টেন্ট। কিডনির কোথায়? Interstitial cells of peritubular vascular bed, right? যেমন proximal convoluted tubule. Whenever you are going to the nephrons, you know the term PCT, right? Proximal convoluted tubules. In that area, some interstitial space or interstitial cells of the peritubular vascular bed, from where erythropoietin is released. এমনি বেরিয়ে যাবে? Not at all. That's what some stimulus will be there. Most important stimulus for this EPO synthesis is hypoxia, right? Synthesis is increased by hypoxia. If anybody you are going to the high altitude, then EPO synthesis will be high. Lots of causes are there. Most important is hypoxia. Other than that is a blood loss, that means blood volume loss, hemorrhage, right? Acidosis. Whenever we are dealing some acidosis patients in due to many causes, that may cause EPO synthesis will be high. right? So erythropoietin will be high, and this erythropoietin come to act here because this pro-erythroblasts are receptor for the erythropoietin. তার জন্য receptors আছে. For what? For the differentiation. কোথায় যাবে? Pro-erythroblast transform into different erythroblast. কি কি? তিনটে. তোদের বইয়ে কি কি লেখা আছে? Normoblast. You can say as a pro-erythronormoblast also. তোদের বইতে থাকে লেখা, আমাকে ভয় পাতে বলে, আমরা নাম্বার দিই, বাট this is a early, intermediate and late normoblast. It is now absolute. Remember that. This is now absolutely absolute in your modern science or modern physiology. Is written in many journal. This term is nowadays is absolute but written in your book. Unfortunate, but this is true. So it is pro-erythroblast. What does mean by blast? Already told you. That means it's a propensity or potential to the proliferation and differentiations, right? Problem is that the size of this pro-erythroblast is huge. That is 20 micrometer, right? Micrometer. RBC কত সাইজ? 7 to 8 micrometer. তার মানে কি 20 থেকে আমার কমে আসতে হবে 7 to 8. কেন? Due to the condensation of the nucleus, due to condensation of the maturation of the DNA, as well as expulsion of the organelles, because RBC have no organelles, there is no mitochondria. কেন mitochondria থাকে না রে? কে বলতে পারবে? কি সুবিধা হয়? Why mitochondria is not present? Tell me. Because the oxidative stress and oxidative, you can say the electron transport chain. তাহলে কি করতো? অক্সিজেনটা ইউটিলাইজ দিত করে। আরবিসির কাজ কি? ক্যারি করে গিয়ে তুমি টিস্যুতে দিয়ে দাও, তুমি আবার ইউজ করবে কেন? বোঝা যাচ্ছে? So mitochondria, if it is present, then your biochemistry chapter, it will come as a electron transport chain. So ATP formations. For the ATP formations, O2 will be utilized. So O2 যেটা ক্যারি করছে Fe+2 তে, সে ওটাকে ইউজ করে দেবে। তাহলে what is the presence of for the delivery to our other tissues? কিছু নেই। তাহলে আমার কি লাভ? তোমাকে রেখে তাহলে আমার কি হলো লাভ? আমার আরবিসি লাভ কোথায়? That's why the solubility of the oxygen is not matched in the blood. So that's why it is carrying protein. This hemoglobin will be there. Within the hemoglobin there is a heme. Within the heme there is a protoporphyrin ring. Within the protoporphyrin ring there is a iron+2. That is a this is a bondings of the each molecules. That is a two molecules of oxygen binding. For what reason? It is released to the other tissues. If it is mitochondria is there, then mitochondria, what will happen? Electron transport chain, right? Mitochondria, ATP formation. So O2 will be used up before the delivery to the other tissues. There is a problem. So that's why during the process these things are going less, and that's why the size of this pro-erythroblast 20 micrometer is come to the 7 to 8 micrometer, right? So diameter is decreasing because of the condensation. Remember that condensation of the nucleus, condensation of your genetic materials, and also the expulsion of the nucleus, expulsion of your organelles. Because here this is a nucleus is present, here mitochondria is present, ribosome is present. Ribosome what is present? Because ribosome is essential for tRNA, mRNA, as well as in the protein synthesis, and hemoglobin globin is a protein. So transcription and translations both are happening here. What do you mean by transcription? It's a DNA to RNA, RNA to mRNA, and mRNA, or maybe some sorts of tRNA here, mRNA to the protein is called translation, right? So transcription and translation both are happening here for the synthesis of globin as well as for synthesis of hemoglobin. Hemoglobin synthesis hobe, aste aste kore hobe. There is no hemoglobin at all. Hemoglobin ke niye RBC size hobe eta, and that is your discoid and red blood cells. So pro-erythroblast transform into three forms of erythroblast. কি কি তারা? প্রথম হচ্ছে বেসোফিলিক, বেসোফিলিক erythroblast, রাইট? তারপরে কি হবে? পলিক্রোমাটিক। কেন নামগুলো বলে টাইম পেলে বলে দিচ্ছি। ক্রোমাটিক erythroblast, and it is called orthochromatic erythroblast. Early, late, intermediate, late normoblast. It is also called. Okay, nowadays it is obsolete. So remember that basophilic erythroblast, polychromatic erythroblast, orthochromatic erythroblast. কেন হলো এরকম? এই যে প্রো erythroblast সেটা দেখতে কেমন হয়? সেটা দেখতে বেশ বড় মতো হয়, রাইট? সেটা দেখতে বেশ বড় মতো হয়। এবং এখানে আমার নিউক্লিয়াস থাকে বেশ পুরোটা জুড়ে, নিউক্লিওলাইও থাকে, নিউক্লিওলাইও থাকে, অ্যান্ড সো অন। দিস পেশেন্টস এইটুকু মাত্র গ্যাপ আছে, দ্যাট আলটিমেটলি প্রসেসে আমার এইটুকু % আমার সেল হবে এবং সেই সেলের মধ্যে শুধুমাত্র আমার হিমোগ্লোবিন থাকবে। এইভাবে 20 থেকে 7-8 হবে। দ্যাট মিনস হোয়াট, এই যে পুরো নিউক্লিয়াস পার্টটা ছোট হতে গেলে কি করতে হবে? কনডেনসেশন, right? Maturation of the DNA. And also ribosomes are present is there. Basophilic means বেশি ব্লু কালারের, দেখতে ব্লু কেন? প্রেজেন্স অফ রাইবোসোমস, রাইট? পলিক্রোমাটিক, কি হলো? অল্প অল্প করে হিমোগ্লোবিন তৈরি করবে, অল্প অল্প করে যদি তৈরি করতে হয় তাহলে রেড কালার আসবে, ব্লু এর সঙ্গে আমার রেড কালার আসবে, রাইট? এখানে ব্লু আছে, এখানে আমার রাইবোসোমস আছে, অলসো সাম হিমোগ্লোবিন অলসো অ্যাপিয়ার। সো যদি বলে কোন স্টেজে আমার হিমোগ্লোবিন অ্যাপিয়ার করতে আরম্ভ করে, দ্যাট ইজ এ polychromatic erythroblast stage. Oftenly asked your questions as well as your MCQ. Orthochromatic means mostly it is hemoglobin, but presence of ribosome also there. After these three, what will form? Reticulocyte. Both up to this এই তিনটে হওয়ার পরে that will form into the reticulocyte. কি হবে এখানে? Reticulocyte. Very important. What do you mean by reticulocyte? Reticulocyte means reticular patterns of some ribosomes are also present, as well as immature RBC. It is called immature RBC. It is present in the bone marrow up to 1 day, then it goes into the blood circulations. Reticulocytes asbe. It will stay in the peripheral circulation 1 day to transform into mature RBC. Right? So, from the pluripotent hepatic stem cell or hemopoietic stem cell, it transforms it divided into 2 lineages, that is a lymphoid lineage and myeloid lineage. In the myeloid part, and this myeloid lineage is causing formation of some progenitor cells, right? So, progenitor cells means committed stem cell. This progenitor committed stem cell form first blast forming unit erythroid series and colony forming unit erythroid. E means erythroid. If it is GM, then granulocyte, monocyte. So this is a different part of when we are go for the WBC synthesis, it will start from here, okay? Whenever we are dealing for the lymphocyte, then the lymphoid series will be there. So now this form and precursor cells for the erythropoiesis, the pro-erythroblast, whose diameter is 20 micrometer. And ultimately differentiation is going on. This is the blast cells. And help of EPO means erythropoietin released from the kidney. Kothai? Interstitial cells of peritubular vascular bed. Right? So these things are happening, and for this reason, for release of the erythropoietin, some stimulus, most of the important stimulus is hypoxia. Remember, it is always, oftenly it is asked, hypoxia. I will come to the details how hypoxia will form the EPO. I will say, it is not for your exam, but your understanding for that reason, because whenever you are dealing any patients with some chronic renal disease means what? তাহলে chronic renal disease আমার কিন্তু anemia হয়, that may come into your exam. Why in case of chronic renal disease anemia can happen? Because of that, if chronic renal problem is there, disease is there, that the synthesis of erythropoietin will be less. If it is less, then the differentiation of this precursor for the erythrocyte synthesis will be less. If it is less, then all the process will be less. Anyway, normal release of this EPO and then stimulation and this one. Another thing is important is that for the augmentation of this process or drive, এটাকে বলা হয় drive, যে আমি erythroid বানাবো, আমার এটা drive, সেই drive কে enhance করা হয় some interleukins, mostly interleukins 1, 3 and 6. These interleukins also helpful for these differentiations. Remember that interleukins also help for your differentiation. তার মানে কি, আমার বিভিন্ন রকমের growth factors, interleukins, hormones are essential for the formation of your erythrocyte from the bone marrow, right? For this erythroblast, basophilic, polychromatic, orthochromatic erythroblast will form. After that reticulocyte, up to this level it is go to the up to the bone marrow. This stage তোকে জিজ্ঞেস করতে পারে কোনটা তাহলে ব্লাডে যায় কে? রেটিকুলোসাইটস। reticulocyte is immature. Retic means some patterns of some ribosomal reticular structure is there for the immature. That's why this immature. Maturity যখনই হচ্ছে তখন এটা আমার আরবিসি তে পরিণত হচ্ছে। Now which stage it releases the nucleus? এতক্ষণ নিউক্লিয়াস ছিল কোত্থেকে বের হলো? অর্থোক্রোমাটিক স্টেজ। অর্থোক্রোমাটিক ইরিথ্রোব্লাস্টে আমার নিউক্লিয়াস এখানে মাইনাস হয়ে যাবে। ইভেন আমার সমস্ত রকমের অর্গানেলস যেরকম মাইটোকন্ড্রিয়া, মোস্ট অফ দ্য রাইবোজোম কেন বলছি না, রেটিকুলোসাইটেও খুব সামান্য রেটিকুলার স্ট্রাকচার অফ রাইবোজোম থাকে। That's why this is happening into the immature, come to the blood, circulations of peripheral blood up to the 1 day, and then transform into the mature RBC. যেটা আমার দরকার, this mature RBC essential for carry of the oxygen, right? Carbon dioxide, as well as is maintain our buffer. Is acts as a buffer, is the hemoglobin acts as a buffer. Within this present is a RBC. RBC membrane, it is your hallmark. Because of RBC membrane structure, if you know, then different diseases will come across, as well as his hallmark is RBC indices. That is also important for your practical purposes. Indices means what? যে কি দেখে আমি বুঝবো যে আরবিসিটার সাইজ বড় না ছোট, এইগুলো আমাকে কিন্তু বুঝতে হবে। For this age, in this process, always remember iron is required, folic acid is required, vitamin B12 is essential, right? Cobalt is essential, copper is essential. These are minerals. So you can broadly say there is a hormone requirement, there is a vitamins requirement, minerals requirements. Within the hormones, erythropoietin, number 1. Number 2, thyroid hormones. Number 3, testosterone hormone. That's why in the male patient, hemoglobin or RBC count is high in case of male. Not like that, যে ফিমেলে আমার মেনস্ট্রুয়েশন হয় বলে সেটা কম, not at all. Yes, it is true that only the in case of female shedding of the epithelial loss during the menstruation of female, that only can release the RBC. No other disease you can release it until unless is breeding, right? Anyway, this is a male testosterone level is high and estrogen level is in case of female is high. Estrogen is inhibitor of the erythropoiesis as well as erythropoietin, and testosterone is activator or stimulator for the erythropoiesis as well as erythropoietin. So these things are important for your short explain why questions. So within the hormones mostly কি বললাম, erythropoietin, thyroid, testosterone mostly these are increase the erythropoiesis. In the vitamins কি আছে, vitamin B12, folic acid, right? Vitamin C, কেন? Vitamin C helps for the iron absorption in your GI. So how iron in our day-to-day taking dietary, how iron goes to the in your bone marrow. This is important for your exam also. I will take them how it is formed and how it is going to the in case of, because in the dietary form it is going in the ferric state, but requirement is in the ferrous state. Ferrous state আমার দরকার, but খাই যখন কি খাই, ferric state খাই, dietary vegetables, meat, in all sorts lots of iron is present in our day-to-day dietary habits. So anyway, this iron is requirement, vitamin C requirement, B12 requirement. Now minerals, কি লাগবে মিনারেলসে? কপার। কেন লাগবে? আয়রনের সঙ্গে যদি পরফাইরিনের কম্বিনেশন করতে হয়, দেন কপার ইজ এসেন্সিয়াল. Copper is required for the association of Fe+2 with your protoporphyrin ring. Okay, and then cobalt. What do you mean by cobalt? Why it is required? Vitamin B12. Vitamin 12 এর আরেকটা নাম কি? Cyanocobalamin, methylcobalamin. These are important. Folic acid, tetrahydrofolate is important. Problem is that তাহলে আমার যদি ফলিক অ্যাসিডটা দরকার ছিল, তাহলে আবার ভিটামিন B12 এর দরকার হলো কেন? ফলিক অ্যাসিড এই কাজ হয়ে যেত, কারণ ফলিক অ্যাসিড ইটসেলফ হেল্পস ফর দ্য ম্যাচুরেশন অফ দ্য ডিএনএ. এই ভিটামিন B12 অ্যান্ড দিস সর্টস অফ ইউর ফলিক অ্যাসিড রিকোয়ারমেন্ট হ্যাপেনিং হেয়ার. কেন লাগছে? কনডেনসেশনস অফ ইউর ক্রোমোজোম. কনডেনসেশন মিনস কি? ছোট 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 করো, তবেই সেলটা ছোট 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 করে যাচ্ছে, এত বড় সেল থেকে ছোট 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 হচ্ছে. Why? It is a condensation of the genetic materials. For the condensation and DNA maturation, it happens due to the presence of key vitamin B12 and folic acid. It will be very much clear after your classes in the biochemistry. Anyway, your vitamin B12, why it is required instead of folic acid is present. Problem is that folic acid in our GI tract, where it is absorbed? Jejunum. Remember that. Iron, duodenum. Vitamin B12, terminal ileum. তাহলে তিনটে জায়গাতে তিনটে জিনিস অ্যাবজর্পশন হচ্ছে, রাইট? কি বললাম? আয়রন ইন দ্য ডিওডেনাম, শুনছিস না তোরা? অ্যান্ড দেন ফলিক অ্যাসিড কোথায়? জেজুনাম। ভিটামিন B12 টার্মিনাল আইলিয়াম। এই টার্মিনাল আইলিয়াম, জেজুনাম, ডিওডেনাম এগুলো নামগুলো শুনেছিস? শুনেছিস, তাও যাক শুনেছিস, ভেরি গুড। সো দিস ভিটামিন B12 is required because tetrahydrofolate format এ মিথাইল গ্রুপ থাকে, মিথাইল টেট্রাহাইড্রোফোলেট, বাট উই ডোন্ট নিড দিস পার্ট, মিথাইল পার্ট আমার দরকার নেই। তখন কি করে ভিটামিন B12 কে বলে ভাই তুই এই মিথাইলটাকে নে, ভিটামিন B12 কে বলে ভাই তুই এই মিথাইলটাকে নে, মিথাইলটাকে নিয়ে থাক, দ্যাট ইজ কল্ড মিথাইল কোবালামাইন, রাইট? That is why called methyl cobalamin. And this methyl vitamin B12 আমারও দরকার নেই, আমার একে দরকার নেই। তখন কি করে না হোমোসিস্টিনকে দিয়ে দেয়, হোমোসিস্টিনকে দিয়ে দেবে। এগুলো বায়োকেমিস্ট্রির পার্ট, আমার পার্ট নয়, তাও আমি বলছি কারণ এটা যেহেতু চলে এলো। হিমোসিস্টিনের ফর্মেশন কি করে না আমার মিথিওনিন, এগুলো বায়োকেমিস্ট্রিতে পড়বি, আমার যেটুকু মনে আছে সেটুকু বললাম। সো দ্যাট ইজ আ মিথাইল টেট্রাহাইড্রোফোলেট। মিথাইল ফর্মটা আমার দরকার নেই, আমার টেট্রাহাইড্রোফোলেটকে ফ্রি করে দিতে হবে। কেন? During the DNA maturation, the tetrahydrofolate, one of the important step to maturation of the DNA. বোঝা গেল? That's why vitamin B12 দরকার। ভিটামিন B12 ডাইরেক্টলি আমাকে ডিএনএ ম্যাচুরেশনে হেল্প করে না। যদি কোশ্চেন ধরে কোনো ভালো এক্সামিনার যে ডিএনএ ম্যাচুরেশনে কোনটা বেশি হেল্প করে, ফলিক অ্যাসিড না ভিটামিন B12, always it is a folic acid, sir. It's a form as a methyl tetrahydrofolate, but if we don't need a methyl tetrahydrofolate, it is requirement only the tetrahydrofolate. So methyl যাবে কোথায়? কে নেবে? না ভিটামিন B12 কে দিয়ে দাও। That's why vitamin B12 is important. So always vitamin B12 and folic acid is essential, and always দেখবি তোরা সবসময় লেখা আছে ভিটামিন B12 ফলিক অ্যাসিড, ভিটামিন ফলিক অ্যাসিড। ভিটামিন B12 কোথাও তুই একা দেখতে পাবি না, কারণ দুজন বন্ধু, একে লাগে ওকে, ওকে লাগে ওকে। সো ইফ ইট ইজ অ্যাবসেন্ট, এটাও নেই এটাও নেই, কি হবে? কন্ডেনসেশন হবে? হবে না। তাহলে কি হবে? সেলটা বড় হয়ে যাবে। সেলটা বড় হলে তাকে কি বলবো? ম্যাক্রোসাইটিক, মেগালোব্লাস্টিক। বুঝতে পারছিস টার্মগুলো আসছে? দ্যাট ইজ ইউর হোমওয়ার্ক, দ্যাট ইজ কল্ড RBC indices. It is your homework. RBC membrane, it is your homework, right? So these things are coming for the diagnosis of the vitamin B12 and folic acid deficiency থাকলে আমরা জানি, আগেও আমরা পড়েছি যে মেগালোব্লাস্টিক অ্যানিমিয়া হয়। What do you mean by that? Cellular structure is macrocytic, সেলটা বড় হয়ে আছে, ডিএনএ ম্যাচুরেশন হয়নি, কন্ডেনসেশন হয়নি, অ্যাবসেন্স আছে। দ্যাটস ওয়াই 20 মাইক্রোমিটার থেকে আরও বড় হতে পারেনি। ইফ নট সো মাচ, সে যদি বড় থাকে তাহলে ফ্লেক্সিবিলিটি থাকবে, তার বাইকনভেক্স শেপ হবে, তাহলে হবে না। তাহলে কি হবে? লাইসিস হবে, হিমোলাইসিস হবে। তাহলে কি হবে না বাইরেতে আমার এক্সট্রা মেডুলারি হিমোলাইসিস হবে। হোয়াট ডু ইউ মিন বাই এক্সট্রা আমার মেডুলারি অ্যান্ড দ্য মেডুলারি? মেডুলারি মিনস বোন ম্যারো, এক্সট্রা মেডুলারি মিনস স্প্লিন অ্যান্ড দ্য লিভার সাইড। এক্সট্রা মানে বাইরে, মেডুলারি মানে বোন ম্যারোর বাইরে কে আছে, এরা ভাঙবে। নর্মালি আমাদের সিনাইল RBC, সিনাইল কথাটা মানে কি না বুড়ো, ACNILE, সিনাইল RBC মানে হচ্ছে বুড়ো হয়ে গেছে RBC। তাহলে 120 দিন হয়ে গেছে, এবার তাকে তো শেষ হতে হবে। দেন গোস টু দ্য স্প্লিন। স্প্লিনে কি আছে? ম্যাক্রোফেজেস, রাইট? সো রিলেট অলওয়েজ লাইক দ্যাট। কি হচ্ছে আলটিমেটলি? পর ভেঙে ভেঙে কি? ইট ইজ ইয়োর বডি, ইয়োর কনসেপ্ট অ্যান্ড ইয়োর ফ্যামিলি মেম্বার্স। Whenever you are dealing in the first MBBS, almost all your family members supposed to do the you are being a doctor. Some sorts 3 মাসের মধ্যে দেখবি তোকে একটা CBC রিপোর্ট ধরাবে কেউ না কেউ। ইফ ইউ ডোন্ট আন্ডারস্ট্যান্ড এট অল কি সব বলছে, then you can say না সব ঠিক আছে, সব ঠিক আছে। Then whenever you going to doctor and say না এতো অনেক কিছু প্রবলেম আছে, then it remarked you, কোনো দিন আর তোর কাছে পরামর্শ নেবে না। রিমেম্বার দ্যাট, ইভেন ইফ ইন ইউর রিলেটিভ। বুঝতে পেরেছিস যে তুমি এটা বলতে পারলে না, ওরা তো জানে না যে একটু শিখতে টাইম লাগবে, দে ডোন্ট নো এট অল। তাহলে যখন মনে হবে যে আমি এটা জানি না, বলবি যে না এটা ঠিক জানি না, প্রবলেম থাকতে পারে, একটু সিনিয়র কনসালটেশনস। এটা বলে দিবি না কিছু নেই, সব ঠিক আছে, দ্যাট ইজ রং। বুঝতে পেরেছিস? এরকম হয়েছে, ফার্স্ট ইয়ারে দেখিয়েছে পেশেন্টের ইয়েতে দেখা যাচ্ছে আরবিসি ইন্ডিসেস পুরো উল্টো পাল্টা হয়ে আছে। বেসিক্যালি হেরিডিটারি স্পিরোসাইটোসিস ছিল। হেরিডিটারি স্পিরোসাইটোসিসে আমি তোদের পড়াবো, ডিটেক্ট করার জন্য একটাই প্যারামিটার লাগে সিবিসিতে, দ্যাট ইজ এমসিএইচসি। এই যে ইন্ডিসেসগুলো বলছি, দ্যাট মিনস হোয়াট, এমসিভি, বাইরে গিয়ে পড়বি, এমসিএইচ, এমসিএইচসি, প্র্যাকটিক্যালে সবসময় হবে, এবং ইভেন ইন ইয়োর এক্সাম সেমিস্টার, কামিং সেমিস্টার অলসো উইল বি গিয়ার indices. So RBC indices, go through it. Only one parameter that is diagnosis is a hereditary spherocytosis is MCHC, mean hemoglobin corpuscular concentrations, right? So in that case it is RBC formation mathay rakh, right? Very very important for your exam, or as well as erythropoietin. তাহলে হোমওয়ার্ক থাকলো কি কি? হোমওয়ার্ক থাকলো RBC membrane, RBC indices, as well as erythropoietin. Okay, oftenly is a come as a short nose as a erythropoietin লেখ, এবার erythropoietin লেখ। সো কোত্থেকে তৈরি হয়, কে কে তার স্টিমুলাস, কিভাবে কাজ করে, কেন হাইপোক্সিয়াতে বেরোয়, সেটা প্রবাবলি নট ইন ইয়োর বুক। I will give the lecture in very short, into 10 minutes. How is in case of hypoxia, that means in high altitude in RBC level will be high, right? তাহলে পাহাড়ে যারা থাকে তাদের RBC level হাই থাকে, তো কেন থাকে তার কারণ পড়তে গেলে এখানে জেনেটিক লেভেলে কাজকর্ম জানতে হবে, একটু 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 জানতে হবে। and that's why EPO means erythropoietin, means protein, means synthesis, কোথা থেকে? ক্রোমোজোম থেকে। আমাকে ট্রান্সলেশন ছাড়া তো কখনো বাবা প্রোটিন তৈরি হবে না, তাই না? তাহলে আমার ট্রান্সক্রিপশন ফ্যাক্টর লাগবে, আমার ট্রান্সলেশন লাগবে, এভরিথিং উইল বি রিকোয়ার্ড ফর দিস সিনথেসিস, অ্যান্ড দ্যাট ইজ অলসো ইয়োর হোমওয়ার্ক। কেউ কেউ পড়ে আয় যে কীভাবে হাইপক্সিয়াতে ইরিথ্রোপয়েটিন বেরোয়। ওকে, থ্যাংক ইউ ভেরি মাচ, দিস ইজ মাই ক্লাস, দিস ইয়োর, থ্যাংক ইউ।